People living with chronic obstructive pulmonary disease, COPD, should receive all recommended vaccines according to national and international guidelines. Vaccination plays a key role in preventing serious respiratory infections, reducing exacerbations, and protecting against life-threatening complications. Annual influenza vaccination is essential for people with COPD. Vaccines containing killed or live inactivated virus are recommended for adults with COPD, and they are more effective in older adults with the condition. High-dose inactivated and adjuvanted inactivated influenza vaccines are acceptable alternatives for older patients and those with comorbidities. Adverse effects are typically mild and short-lived, such as soreness at the injection site or mild fatigue. Pneumococcal vaccination is equally important in preventing pneumonia and reducing COPD exacerbations. Conjugate vaccines including PCV15 or PCV20 and the newer PCV21, as well as the polysaccharide vaccine PPSV23, are approved for all adults aged 65 years and older. Additionally, they are recommended for those aged 19 to 64 years with chronic lung diseases such as COPD or asthma, as well as for current smokers and others at increased risk. Adults who have never received a pneumococcal conjugate vaccine or whose vaccination history is unknown should receive either PCV15 followed by PPSV23 or a single dose of PCV20 or PCV21. Pneumococcal and influenza vaccines can be administered safely during the same visit, improving adherence and convenience. Respiratory syncytial virus, RSV, is another important cause of respiratory illness in older adults and in those with chronic lung disease. New RSV vaccines are now recommended for adults aged 75 and older, and for those aged 60 and above who are at high risk due to chronic heart or lung disease, immunosuppression, or residence in long-term care facilities. Pertussis whooping cough also poses a risk for people with COPD. The TDAP vaccine, also referred to as DTAP/DTPA, protects against tetanus, diphtheria, and pertussis and is recommended by the CDC for adults who have not previously received a TDAP booster in adolescence. This helps prevent severe coughing episodes that can trigger exacerbations and rib fractures. Adults with COPD should also receive the shingles herpes zoster vaccine routinely, as recommended for older adults, to prevent painful and potentially disabling reactivation of the varicella zoster virus. In addition, people living with COPD should stay up to date with COVID-19 vaccinations according to national recommendations, as SARS-CoV-2 infection increases the risk of severe disease, prolonged recovery, and COPD exacerbations. Vaccination saves lives. For every person with COPD, ensuring influenza, pneumococcal, RSV, pertussis, shingles, and COVID-19 vaccinations are up to date is one of the simplest and most effective ways to prevent serious illness, reduce hospitalizations, and improve quality of life. Now, time to solve a short quiz to reinforce your learning. A set of selected IPCRG resources will be available for you at the end of this breath.